Greetings, everyone, and thank you for joining me on this episode. On this podcast, we explore topics of interest for professionals at the intersection of public health and entrepreneurship. My name is Dr. Charlotte Huntley, and I'm excited that you've decided to tune into this episode. I'm a public health entrepreneur with over 25 years of experience in healthcare and in public health, and I've supported a lot of entrepreneurs along the way. I'm excited to support you as well. On this episode today, I want to share with you a lesson learned on vulnerability. And I say a lesson learned. You may think, what does this have to do? We all understand the importance of being vulnerable. And I knew this going in. In fact, and put a little bit of foundation here. Each year, I choose a word of the year. That word of the year keeps me focused. In the past, it's been freedom, visibility. It's whatever it is I think I need to be doing or focusing on that's going to help move me toward the goal I have for the year. This year, my word for the year was vulnerable because my ultimate goal was to build stronger relationships with my clients. As a consultant leading a BIPOC focused consulting firm, our clients are all Black, Indigenous, people of color leaders serving these kind of communities. And building trust is not something that happens overnight. So we have strong relationships with our clients. And my goal was for us to strengthen those relationships and then selectively look to build and connect with one or two new clients to add to our community of clients, just in a very intentional way. But I knew that being vulnerable has served me well in the past. It's not the comfortable thing to do, especially if someone like me, I'm a little bit more private. So being vulnerable, it's not like telling all of your business or putting yourself all out there. It's a little different. You do decide where the boundaries are, but you do make set an intention. You make a decision to be more open, more relatable, more real with the people that you're serving. And that was part of my goal. That was my focus for the year. I had no idea all the things that would happen to me personally this year. But even if you listen to this podcast for a while, you've heard me be very vulnerable and open with you about the walk and the journey, especially when it comes to grief and the things that my family has had to go through. I think that is when we can let our guard down a bit and we decide to open up a little bit and move in a little closer, we can strengthen and build. We can humanize all of this. Everything is in a digital and online virtual kind of environment. And being vulnerable allows us to humanize this process and really connect with people. So I say all of that to say I was invited to serve as a keynote speaker for the Black Caucus of Health Workers Awards Gala during our large public health conference that was held recently. I was excited and went through all the things you go through when you're getting ready for a conference or speaking, especially keynoting. And I began to think about what I wanted to share with the people. I thought about who's going to be in there. In this room, these are award winners. So these are the top leaders who all serve Black communities and are celebrating excellence. As a leader myself, I think about the culture as a Black woman, and I think about what it might be like for the people in the room. And all of my focus was on them. I wanted to share something that was going to be relevant for them. It was all about them. I thought about the many hats that they wear and what some of the challenges may be like and how similar it may be for us across the board. And then I thought about the time that we're in, because at the time of the conference, it was a week before our presidential election, one of our most important, significant presidential elections ever, really, but certainly in a very long time. And what this meant for the leaders and how we would, no matter who won the election, there's a lot of work in front of us. So I was thinking about all of them. And I chose to be vulnerable in that time because in order for me to, and I was thinking of this ahead of time, in order for me to reach this particular group of leaders who might be even more headstrong than I am and packing everything down, and we're always doing all this stuff. And also to add to it, the conference itself had a theme of superheroes, public health superheroes, or public health heroes. So that means that we're putting on our capes and our best selves and showing up and doing all the things. I thought, let me pull back my cape, show you my scars that are in the process of healing, but they're healed enough that I can talk about the progress I've made so far. And I decided to do that in order to share some insights and some encouragement for this group. Now, I could have just shared my 3 points that I wanted them to take away, but sometimes without being vulnerable, without relating to people, it doesn't quite fall as well as when you are choosing to be vulnerable and open and relating to them. There's an old phrase, people don't care how much you know until they know how much you care. And I think that partially played into this scenario. So fast forward a little bit, we got to the event. It was a lot of fun. There were some wonderful connections in the room, people that I didn't know that were already listening to my podcast. This is a relatively new podcast, the one you're listening to right now that we're talking. We started in April of 2024. But my first podcast, I started in 2017, and we've had new episodes every week since then. So well over 300, almost 400 episodes. And people in that room had been listening to that podcast. These leaders had been listening to that podcast and were showing me and really talking to me about, demonstrating to me how certain takeaways or what they like about it, or their listening routine. It was pretty humbling for me to experience that, but I really connected with people in that room. Most of them were senior career professionals in excellent roles and having great impact on their communities. There were a few young people that are young professionals. There were a few fellows that were rising leaders and very eager, enthusiastic. And I can tell you from experience, and I've been exercising, walking this new level of vulnerability all year. I know the power. We hear that it's important that we be vulnerable and real and authentic with people to develop, strong and genuine relationships. But what I learned from this decision to be vulnerable and share with this group in this way blew me away. For the whole night, I had people lined up to meet with me, hug me, take pictures, and I welcome all the hugs. It was so healing for me. I found out in the process of focusing on them and serving them, I experienced a level of healing myself. People shared with me what parts of my story resonated with them and some things that they had, some challenges, similar challenges that they had gone through. And then those 3 takeaways that I shared with them, several people shared with me which one of those they were going to put into action. And it was almost like a point of a bit of accountability. They wanted to let me know what they were going to do so that I could check in with them later and find out how they were doing. But to witness that throughout the night, and then even the next day, throughout the next day was the last day of the conference. And as I moved around the conference center, we're talking well over 10,000 people. I think we're waiting for an official count. I heard people say 11,000. I've heard 12,000. But with that many people at a conference attending and moving throughout the crowd on that last day, there were several people that came up to me who had been in the room that night before when I spoke to share with me how much it meant to them, what resonated with them, what their takeaways were, how much they appreciated me being open and honestly sharing my perspective. It got their attention. It made them think, oh, wow, I was relatable to so many people in the room. And sometimes that's what we need to do, because I even said to them that night, if you only see my pictures and posts on social media, or only hear the finished, polished episodes of these podcasts, you don't know what I go through to make it happen. And it's not that I have to put all the ugly out there, but I do find ways to try to be relatable and open and share with people more of what's going on and what's happening, being more vulnerable. That night was a whole new level of being vulnerable for me, and it returned back to me, oh my goodness, 100-fold in the relationships, in the connection, and the reward of knowing that I was able to help other people through what I've gone through and what I shared with them. So that is my most recent and fresh lesson learned on vulnerability. So it's not like it's my first time choosing to do this. It's just that we have so much room to continue to level up, all of us, in whatever it is that we do, including something like vulnerability and lesson that I've learned in that experience. So I wanted to share that with you. I encourage you to embrace where you are, whatever you choose to focus on, if it's being more visible or being vulnerable or being intentional, whatever it is you choose to do, know that it will make a difference on a level that's bigger than you are, and look for those lessons, embrace them, take them in, and reflect on them often, because that's how we grow. And we're all on this journey together, right? We're all serving, looking to serve and protect our communities and improve their health. However, we choose to serve, we collectively are looking to help improve the health of the people that we care so much about. Before we go, I would like to remind you about our mastermind group program. I hope that you would consider membership if this is a good fit for you. You can learn all about it at publichealthentrepreneurs.com. When you're there, just click on Mastermind Program. There's a full page that has all the details. Now, if you're interested, you'll need to take the next step and apply, submit an application. That lets us know that you're interested. We follow up with you, make sure all of your questions are answered. And once enrollment opens, we invite you to join us if it's a good fit. Enrollment is only open twice a year. So early December and in June. Those are the only two times that you're able to enroll. And again, we only extend the opportunity, the invitation for enrollment to people who've submitted an application. So I hope that you will consider that opportunity. Thank you so much for tuning in and being with me on this podcast journey. I hope that this is valuable to you. I even met several people at the conference who are listeners of this podcast and did mention how much they are enjoying these episodes. And several of you are just thinking about exploring the idea of a business. You haven't started yet. You're not even sure you want to start, but you're thinking about it and you're considering it. And I'm really happy that you're using this podcast as a resource to help you. I know that I met a few people that are ready for this enrollment period of the mastermind, and they actually have joined a webinar that we've had since then, and they're considering enrollment, and I'm excited about that as well. So this is certainly a venture that I'm enjoying as a podcaster for so many years, but knowing that this new podcast has taken off and is establishing a strong community is really exciting for me to know. And so I just want you to know that I appreciate you all. All right, everyone. Until next time, have a fantastic rest of your day.